Hi, we are going to talk about sex today. This is my third video on sex. And we're going to talk about do it dirty because that's the topic. It's going to be a quick and dirty video. Just want to let you know at the end of the video, I'm going to be giving you some value. I'm going to be telling you women special things that men love to smell that increases the blood flow to his nether parts. I think you guys can handle the word penis. Yeah, I think you can handle it. So I'm going to give that at the end, and I'm going to give some other scholarly stuff, but we're going to talk about the nitty gritty stuff in the beginning. So yesterday I did this nice video. It was at the beach. I was showing you the ocean. It was about the qigong because I was talking about how I'm committed to sharing qigong with my patients, especially, so I have to start using the word client now. I'm in my doctorate program and they're coaching us to say the word client. So after 22 years, I'm still learning. So I'm really committed to my fertility clients to help them have that picture. Babies. I have my baby. I know you're tired of hearing this, but I'm going to keep saying it because there's a reason why I want you to hear. I have my babies naturally at 30, 36, and 43. I look young. Don't I look young? I look young. And it's because the acupuncture, the qigong, the herbs, I talked about that in the other video. And then a few weeks ago, I talked about relaxing and how acupuncture is so relaxing. Today, we're going to go talking about, my third video about libido, about sexual arousal, about doing what you got to do to have a baby. So you want to have a baby. You cannot be so, about sex. It's got to be fun. It's got to be dirty. It's got to be, I did videos. I don't know, why I'm doing another one. I talked about sloppy sex. I really broke that down in the first video. I'm bringing this up again, before I talk about all the stuff to arouse men. And please do watch this with your husband. Do watch this with your partner. This is for you guys. If you want to have babies, if you want to be pregnant, you got to do the work. You got to do the work. You have to do the work. And there's no more fun job than sex. If sex is uncomfortable, we need to talk. Then I have to fix that. Once I start talking to women and I say, your man has to have sex 3 times a week. No. They get upset because it hurts. Okay, if it hurts, that's a conversation we have to have. So let's stick to the topic, quick and dirty. I have a client who I used to treat her many years ago. That she has 2 babies now. I treated her and her husband, and they were coming in for anxiety. They had a lot of anxiety. And they said, we've also been trying to have babies for the last 10 years, and it's not been happening. But they didn't think I could help. So they said, if you could just really help our anxiety, that would help us tremendously. And if we get pregnant, then great. And I said, well, you better watch what you ask for because that's what I do. I deliver results. And they didn't believe me so much so that they both enrolled back in school. I said, all right, that's cool. So then I was treating them and they now have 2 babies. But the reason why I'm sharing this particular case, I've made a lot of babies since 1999. I've made 3 of my own and I've made a lot here. And in the video I shared yesterday, 3 positive pregnancy tests in the last 2.5, 3 weeks. And a couple of months ago, less than 2 months ago, 4 positive pregnancy tests, 4 pregnancy tests, 4 positives. So there's something I'm doing that's right, whether it's natural, IVF, or IUI. So this particular client, the husband and the wife, they were coming in for anxiety. They enrolled in school. And then they said, if you can get us pregnant, great. If you can't, oh well. I said, well, there's no oh well here. Oh well here. We'll see what happens. One thing that she did was I broke down, and this is what I'm having to do now. So if you're my fertility patient, we're going to be talking about this, how you're having sex. Turned out that she had a lot of UTIs, and every time she would have to have sex, it would be very mechanical. And that is exactly what we're going to talk about today. She would have to have the sheets cleaned, have him take a bath. She would have to take a bath, and then they would have sex, and then she'd have to take a bath again, and she would have to change the sheets again so she wouldn't have a UTI. I fixed all that. I changed all that. She stopped having UTIs and she was able to just have dirty sex, just fun, dirty sex. And she has 2 babies. My client today, I'm talking with her because I did a sex video a month ago or so. And she said that she has to have her husband take a shower before they have sex. Now, stop doing that. If you can't have sex without having a UTI, we got to fix that. If you can't have sex because you have some OCD issues, we have to fix that. You should just get down and dirty. Just have fun. So this was for my client today. This was her homework. I said, I need you to go and get something sexy. Hey, you can spend less than $30. I'm not asking you to spend $80. You know, I'd rather you have a bunch of things that, you know, you're not going to be sleeping in it anyways. Just go get the ones on sale. Get something that's different. Wear it underneath. You guys don't know what I'm wearing underneath, do you? Your underwear should always be sexy. Always wear sexy underwear. Whether you want to wear a bra or not, that's up to you. Wear sexy underwear for yourself at least. For yourself at least. I said, go and get something sexy. I said, if you don't do this in the next 48 hours, it's not going to happen. And if you want a baby, you would watch this and you're going to follow my advice, especially for the next 48 hours. So I said, I want you to get something sexy. If you have a bunch of red stuff, then get a different color, but wear it under your scrubs. Wear it under your suit. Wear it under whatever, you know, yeah, and wear it all day. You know, it might itch. It might, you know, you might have a hard time, or go to the bathroom out after work and put it on underneath and then surprise him. Come into the door. What you would normally do, just close the windows if you want and just have at it. Just do it. If you want a baby, you do that. If you want a baby, do that. He's going to be like, what is going on with my wife, my girlfriend? Because if it's very structured, trust me, he is bored. He's bored. He's tired of the vanilla. He's tired. And I hope he's watching this. Do not hide this from him. I will share this with your man. He will want to hear this, that he needs to have sex at least 3 times a week. And he wants to be surprised. Dude, surprise him. Say things you would normally not say. If you do the same thing constantly, if you want different results in your life, you have to do things differently. If you want things in your life to change, you have to change things in your life. You can't keep having the same sex for the last year and then expecting a baby. That's not how this happened. I said it, I think this is fertility video 17. But it's definitely sex video number 3. I did not accidentally get pregnant at age 43 by planning it. We were having fun. I'm saying this again, we were having sloppy sex. We were doing sex in the hotels. We were doing whatever we want because our kids, and I'm sure they're not going to want to hear this later, but hopefully they don't watch. They were 13 and 6. 13 and 7. There was a 6-year difference and a 7-year difference. And all 3 of my kids, I did not do all this planning. I worked on myself. I did qigong, acupuncture, and herbs. Those are other videos where this is strictly sex time, okay? I think I've said sex at least 40 times now, so you get the point. All right, I'm going to give you some value. So I hope I still have your attention. So I told you women what you need to do. 40% of fertility issues is the man, all right? But here's the thing. I can tell you if it's inexplicable fertility issues, or what they call inexplicable infertility, just get down to the basics. Are you liking it or not? Are you humping or not? Are you having fun or not? Are you, you know, I mean, I don't want to breach any like boundaries. If you got to watch some porn, watch some porn. And if you're like, you know, I'm not going to do that, then let me tell you that you might want to do something, women, to arouse yourself. Number 1, you need to stop working. I said that how many times? You got to stop working so hard. I shared in my video yesterday that I got 3 pregnancy tests, 3 positive pregnancies. 2 of them natural, 1 of them IVF. Now, this is not for any of my IVF patients. This is strictly for the natural fertility ones. If you're doing IUI, that's fine. But this is especially for the patients my clients who want to just hump and have a baby. Hump and get pregnant and have a baby. The good old-fashioned way that God intended. you gotta take care of yourself. You have to want to put on some makeup for yourself. You gotta want to put on some heels. And I talk about it in the other videos, but you have to want to do it. You have to want to. I had a client the other day, Saturday, today's Thursday, and she said, I told her, because they're having issues with their marriage. You know how many people have issues with their marriages? And I tell them, you guys need to just, have a little dirty sex. She goes, ugh. And she rolled her eyes. You know how many women here roll their eyes when I say the S-E-X word? Why? Because it either hurts or they're not attracted to their husband anymore. And let me tell you something, and it's not to be condescending to men. Men are very simple creatures. If you're not happy, he's not happy. If you don't want to have sex, he doesn't want to have sex. You know what I mean? But if you want to have a baby, you got to put some effort into yourself. You might want to do some things to, I'm always talking about healthy, happy, make you powerful. Well, nothing's going to happen if there's no connection between your husband and you. You don't want to hear this, but you have to hear this. For every woman out there that wants to have a baby, surprise him. Walk in through the door, close all the curtains if you want, or keep them open if you want to entertain people, and take it all off and show him something that he would normally not see. Just say things that he would normally not hear from you. So here's some of the value I want to give you in this Do a Dirty Baby video. I talked about do not shower, wear sexy outfits, get plenty of rest. I really broke that down in the last video. Please watch that. Think of nothing else. This is what I was going to say. My client who is in medicine, she has her own private practice, and she's been wanting to have a baby. And she did IUI last year, and it didn't work. And I didn't hear from her she did not follow my protocol. And I did not hear from her from February until October. And then late September, October 2020, she said, okay, what did I do wrong? That is a perfect question. If it didn't work, you ask someone who had 3 kids and is helping a lot of women get pregnant, especially naturally, what did I do wrong? So then I can correct it and do what's right. And I said, follow this protocol. And there was the acupuncture protocol. There's like how many times I need you to come, once a week, twice a week, 3 times a week, or whatever. And one thing that I said over and over and over in my videos is if you want that picture, if you want 1 or more children, you're going to have to make some changes in your life. If you keep working hard as a lawyer, if you keep working hard as a doctor, if you keep working hard on whatever it is that you do as a nurse or, as a teacher or whatever, and you keep putting focus on that job, in 10 years, you're going to be the best lawyer. You're going to be the best doctor. You're going to be the best nurse. And you're not going to have kids. And that hurts. That one hurts. But that is the truth. And that's something that no one's going to tell you. And so you can go to the fertility clinic and they're happy to take your money and they're happy to work with you because it is a multi-million-dollar industry, if not billion-dollar industry. So many women in our culture can't get pregnant. I got my car. I know I'm kind of going all over the place right now, but I think you women need to hear this. I got my car. Someone rammed into us in Lake Arrowhead. And I got the car back. I was driving a rental, and it was my husband driving. This young people, look behind you when you reverse. This woman hit us from the front, going in reverse. I got my car back. And I like to talk with people. So the guy who drove me from Hertz to the auto collision place, he said, I like to make conversation. And he said, yeah, my daughter's 24 and she has already made me a grandpa. I have 2 grandkids. And he was a little bit on the embarrassed side. And I said, no, why are you embarrassed? That's awesome. My mom had me when she was 21. And sorry, there's a thing here. And I said, and he was like, yeah. I said, you're going to be very close with these grandkids. And she's going to be very close with her kids. Why? Because in our early 20s, we're primed to have a baby. That's when we're primed. But here's the thing. I'm going to tell you right now. I'm college educated. And I got my master's in 1998. And in the early 2000s, they started having the doctorate program for Chinese medicine. But 2004, I had my first child. 2010, I had my second child. In 2017, I had my third child. Same man, all natural. When they started having the doctorate program, I did not enroll in the program because I focused on having a baby. So when I say think of nothing else, I really mean it. Don't think of anything else. Go to work, do your job. Ask your husband, hey, I'm eventually gonna have to cut some hours anyways. So can you work longer and do what you gotta do, work out so you can come home horny so we can grow our family? That's really how it should be. But I know, I got some haters right now because that doesn't sound very feminist. And keep in mind, I own my own business. In fact, I have 2 businesses. And so I run my own shit. I get it. Women, you know, and now I'm in my doctorate. And this is my 22nd year in practice. Last year was my 21st, and I enrolled then. And I took 1 class per semester. I got a 99% in the first semester, a 96% in the second semester. And this is my first time taking 2 classes. And that second class, which is just 1 unit, a 3 unit and 1 unit, that 1 unit is kicking my butt. Not the 1 unit, the combination of 2 classes and having a business and having 3 kids. And luckily with this third time around, I have a nanny. What I'm sharing with you my life because it comes at a cost. And you know what that cost is? Our youth. You know what that cost is? Our time. It's our energy. And ladies, if you're educated, if you're working, if you're putting in 35 plus hours a week and you're tired when you get home and you're not hot and horny like I talk about in the other videos, you ain't gonna get pregnant. Because that vanilla sex may not get it done. With each of those kids, and I know my kids are not going to want to hear this later, but I'm going to tell you right now, especially number 3 at 40, especially number 3 when I was 43, that was not vanilla sex. That was sloppy sex in a hotel when I was not ovulating. That's why I don't care about your ovulation papers. You can check every 4 months. That's cool. I'm going to look at it. But you know what I'm going to want to hear? Oh man, I was so horny this month. So my medical, the person who's in medicine, I want to keep her private, who is now pregnant. And I pray that the pregnancy lasts. I've got quite a few women pregnant right now. She said, I knew I was going to get pregnant because the herbs that I put her on and the acupuncture. She came back in October, November, December, January, February, 4th month, got pregnant naturally. We were on our way to having to prepare for IVF, but I'm like, man, I'm determined to get this girl pregnant. And she said, yeah, that stuff you've been doing, yeah, and that's about it. That's about right. After 3 months, your vitality, your sexual arousal. So I hope you're getting something out of this. I hope you're hearing what I want to deliver to you, which is, no showering before sex. You can shower afterwards, but I want it just down and dirty. Down and dirty. I don't know how else to make that clear. No more shower. I broke down the first sex video and then sloppy sex, the second sex video, and now I'm breaking it down again. No showering. Please, trust me. If you come home and you look hot and heavy and, sexy and you're ready to go and your husband's like, oh my gosh, trust me, he will put down the pizza and the beer and he's going to want to get some of that. So just something to consider. Get plenty of rest. Think of nothing else. Make yourself horny. What do you got to do? What do you got to do to make yourself horny? Go to a sex store. Go online. I mean, if we're doing this naturally, get creative. If you're doing things at 5 in the morning and you haven't been able to get sex for the past year, try doing 3 in the afternoon. Try skipping work for once. Try dating each other. Go on dates. Go to the hotel. Just go to the hotel. I have these clients. Wife's a physician, and they're a lovely couple. I love them. They're awesome. And they do the hotel app. And they just go. She wears this nice coat, very elegant, with nothing underneath. And nice heels, or something really raunchy. I think I broke that down in the first video. Yeah, you got to practice. And if she's a physician and she has kids and they were all natural, don't you think she knows what she's talking about? So, and she happens to be a physician who knows tremendous information about sexuality. I'll just leave it at that. So, and she practices medicine. So do what you need to do to make your husband feel number one. Do what you need to do to make your husband feel number one. Surprise him. So now we're going to go straight to the scents. You made it this far. It is 20 minutes. So oranges increase men's arousal. And when I say men's arousal, I'm talking about blood flow to the penile area. You guys can handle that word, right? Penis? You guys can handle that. I think I can go ahead and say it. So the scent of oranges has been found in research to increase 19% or more blood flow to the increases his erection. That's cool. 19+%. Black licorice, as controversial as that candy is, has been found to increase blood flow to the penile area by 13%. That's a good one. Oh, you're going to love this. You are going to love this, especially someone I know that, this DJ that I follow, DJ Alpha, there's your little shout out. 32% increase in the penile area. Donuts. The scent of donuts increases blood flow to the penile area by 32%. Oh, that's awesome. Lily of the Valley, floral scent. This is a floral scent. It increases arousal by 11%. Now, I'm going to read some fun things that you might want to know, women. The floral scent, Lily of the Valley, also increases your chances of getting pregnant. Oh my gosh, that's so awesome. That's exactly what we're talking about, right? So I went on PubMed, I went on Google Scholar. This information you're getting from fragranceex.com. So something to consider. Where is it that I wrote that? Lily of the Valley found that women are more likely to get pregnant when wearing it during intercourse. So women, wear your Lily of the Valley. That will increase your chances of getting pregnant during intercourse. All right, so I'm probably going to find some Lily of the Valley and put it on my website so you can just click on my link and buy it there. Pumpkin pie and lavender increases blood flow to his male parts by 40%. Oh my gosh, pumpkin pie and lavender increases blood flow to his male parts by 40%. Something to consider. Let me see. So during the holidays, November, December, January, February, March, April, May, June, July, August. So see who gets pregnant July, August, September. Because, around the time where it was pumpkin season, men probably were eating a little more pumpkin pie. Some researchers think that it's the vanilla in the pumpkin pie. But that's a good one to remember. Pumpkin pie and lavender increases blood flow to the penile area by 40%. Pumpkin pie and the smell of donuts mixed together, the smell increases blood flow to penile area by 31.5%. I don't know how they do these studies. I think this is very interesting. Pumpkin pie and smell of donuts increases blood flow by 31.5%. Vanilla increases blood flow by 9% to the penile area. And rose, the scent of roses, increases fertility and confidence. So we'll see what happens. February 14, March, April, May, June, July, August, September, October, November. So, all these November babies. My husband's birthday is November 10. My birthday is December 19. Might have something to do with the fact that there's love in the air around February. Strawberry, jasmine, ginger, cinnamon, pink grapefruit, sandalwood, all increase, and peppermint. So that's the value I'm giving you today, but there's one more thing I want to share. This one is a study that I did, that I looked up aphrodisiac and men on PubMed.gov. Okay, sexual dysfunction and infertility are conditions with high prevalence in the general population. Nutritional factors have been reported to have an impact on sexual and reproductive health. Now, what did we say earlier? 40% of male fertility issues is the man. So I gave you the hot and heavy conversation. I gave you the value of what scents to wear, how to arouse your man. Now this is more scholarly. Just hang in there with me. There, you might learn something, okay? So let's see what the research says. So they did this literature research from the Cochrane Library, Medline, and Science Direct without any time limitations. Results. This is going to take a minute of your time. Obesity has a negative influence on male infertility. So make sure you guys are both working out, not too intensely, okay? Just moderately, so you have energy to have sex. Weight loss improves male fertility. Food insufficiency is associated with increased sexual risk behaviors, more significant in women. Regarding macronutrients and group foods, trans fatty acids, high glycemic index food, high carbohydrate diet, and high animal protein intake prejudices fertility. So you want to increase omega-3, omega-6 fatty acids, low glycemic index food, and low carbohydrate diet. Vegetable proteins, antioxidants improve fertility. All right, what is the name of this? It's the study is Food with Influence in the Sexual and Reproductive Health by Tania Silva, Mariana Jesus or Jesus, Cesar Sagigal, Carla Silva. You can find that on PubMed. It was the first one that pulled up, I think. I just looked up aphrodisiac and men. I want to give you more of this the study. Isoflavones have a negative impact on men fertility. Ooh, so whatever that is, isoflavones, that has a negative impact on men infertility and improves sexual health of menopausal women. We're not talking about menopause right now. We're talking about women having periods and women who can get pregnant. Whole milk improves women fertility. Women, drink some whole milk. Drink some whole milk, women. Drink some whole milk because it will increase your fertility. This is a study that I'm reading right now. But men benefit from skim milk. So get your man to drink skim milk and women drink whole milk. If you're not a milk drinker, I understand. I primarily drink oat milk. But hey, if you want a baby, do different things. If you're not going to have an allergic reaction to dairy, try this. Remember, we need to do different things. Take off your clothes. Just have sex. Don't take a bath until after. Don't change the sheets. Don't do anything mechanical. I gave my client 3 pieces of homework today, and that was do 3 different positions. Come home, have the outfit on underneath your scrubs or underneath your suit, whatever, and close all the blinds and just get him. Just pin him down and get him. And don't think, well, I'm not ovulating. No. That's a different video. I did not say anything about ovulation. I said just get in the habit of having wild sex, okay? Get in the habit. Concerning dietary supplements, there is weak evidence sustaining efficacy, and the most promising supplements are yohimbine. I don't know what that is. I'll have to look that up later. yohimbine. Yohimbine. Vitamin B as in baby, L-arginine, and vitamin D. So, the conclusion. The compiled results indicate that despite the multifactorial etiology of sexual reproductive dysfunction, nutritional factors may affect the sexual and reproductive health in both men and women. However, it just needs more studies. So I told you what you need to do. I gave you some value in regards to what scents men love. I think that was very interesting. Please share this with everyone. And then I gave you a little PubMed stuff. But I'm going to give you one more piece of advice. And if you're not trying to have babies and you're still on this video, then I must have done something right, because it's a long video. It's 30 minutes already. the better your sex life is, the better your marriage is. And when I hear about people having, wanting to leave, wanting to have divorces, we did therapy, the therapist didn't help, the person, I hear that. We did therapy. We went and saw 2 therapists and it didn't help. You know what trumps therapy? Awesome sex. Yeah, I understand. I've had moments, many moments in my marriage where it was just tough. And you're not interested, you're sleeping in different rooms, you're arguing about money, you're arguing about, jealousy, you're arguing about he's not home, you're arguing about he might not be a great father, or you might not be a great mother, or, whatever. But if you can just get down to the basics of just connecting on a very primal manner. I know I was really intense in this video, but if you can just be a man and a woman and just hold each other naked, something magical might just happen. All right. I hope this was of tremendous value to you. I hope that you share this with everyone you know. And I hope that each of you who come see me, whether it's for natural or IVF or IUI, I really hope that you have a baby. The next qigong class, everyone's asking me, and I'm very grateful for it. So I'm going to share it right now since you're still here. So it will not be until March. It will not be the first Sunday of March because I am teaching a fertility Zoom to my students. So if you are an acupuncturist, you might want to join my fertility Zoom. So the next one is going to be, looks like it might not be until March 28th. If I can do it before then, you will know. But for now, please plan on March 28th, Sunday at 9 a.m. If you are interested in taking my qigong class, please do telegram or text me at 619-341-4341. I've shared a lot of videos so far about fertility. I take all the difficult cases. All you need to do is be committed. All right. I hope you have a great day. And please like and share and subscribe. And I'll see you in my office, Elements in Harmony, acupuncture.com. Take care. 949-305-1703. I'm making this straight on my phone, 619-341-4341. Take care.